Let's return to the news that we had about 40 minutes ago, that two new cases of a new coronavirus strain, first reported in the Philippines, have been found in England. A little bit more information has just come through on the Press Association in the last few minutes. Professor Andrew Hayward is Director of the Institute of Epidemiology and Healthcare at UCL. Thank you for joining us. And I know you are not across all the information about this at the moment, but can we just start with a sort of broad outlook here? A new variant, new fears that it might cause more problems for a vaccine. Why do we think that?
Well, I think from what I can gather, this variant is similar in some ways to the variants that have previously been identified in South Africa and Brazil in terms of some of the mutations that it has. And those are mutations that can potentially lead to the strain being more transmissible, but also one of the mutations within it is one that can mean that antibodies against the virus are less effective, whether those be antibodies derived through natural infection or through vaccine. And so it's a similar situation to that. It doesn't look as though it would remove the effectiveness of vaccines or antibodies, but it might reduce them. So obviously we want to do everything that we can to stop a strain like that spreading.
We pride ourselves as a country, and I think we have that international reputation of being able to get on top and analyse these new strains remarkably quickly. So what sort of time frame are we looking at before we understand how serious or perhaps less serious this might be?
Well, I think what we tend to do when we do identify these variants is, first of all, we're trying to estimate how common they are. So far, they haven't spread very much within the UK, apart from our own UK variant. I think that's partly because we've been in lockdown, so none of the strains are spreading very effectively. I think as we move out of lockdown with less restrictions, then we might expect to start to see some of them spread more. And so it's going to be over that sort of time period that we'll gain a better understanding of what impact they may have in our country. In the meantime, of course, we'll be looking at international data to try and understand in particular what impact this strain has had in the Philippines.
Yeah, in fact, the Press Association has said that it was first reported on March the 9th by the Philippines when 33 cases were recorded. So it's not that long ago. Presumably, it will mean here, will it, more testing and trying to identify precisely where these people have been and who they've been in contact with?
Yeah, I mean, I think it will be similar to, for example, with the South African and Brazilian variant, where we see cases come up. We want to intensify testing in the areas around those cases, partly so we can check that it hasn't really spread beyond those initial cases. I guess that's the main reason for doing that, and so we can control the spread of it more. Of course, we don't test all laboratory isolates of infection because it's quite an involved process, which involves doing detailed genetic sequencing of viruses. So at the moment, we do a subset. I think the longer-term plan, particularly as case numbers reduce, would be to be doing an increasing proportion of them, maybe eventually even all of the ones that we identify, so that we can keep a very close eye on it. And also, of course, support other countries in doing sequencing so that we can understand what the problems coming around the corner are.
All right. Okay. Thank you very much, Professor Andrew Hayward, for joining us this evening. Thank you.